For all you parents out there already thinking about shots and immunizations because of back to school, there is a whooping cough outbreak across the state right now, and so we brought in Dr. Dwayne Wooten. Once again, thank you for coming in live with us.
My pleasure.
Okay, you get a lot of parents. There's been this increasing trend asking about, tell me about the science, doctor, of immunizations, and there's a lot more parents who are trying to opt out, saying, I don't think that it's necessary. I'm worried about the possible complications or otherwise. But you said the science. The proof is in the pudding.
That's right. You know, they are concerned about complications that really don't exist significantly. I mean, I've given over 800,000 vaccines in my practice in almost 30 years, and I've never had an adverse reaction to a shot. And, you know, for whatever reason, there is this great upheaval of anti-vaccinations in America, especially in this state. And we had eradicated many disease processes off the face of the earth for the most part that are coming back, like polio.
Right.
Because people refuse to get their children vaccinated, and it's just no science that supports that.
Yeah, and just days ago, the state health department was releasing these stats, a 300% spike in whooping cough cases, and they said they pointed to a particular cluster in Colorado City where, of course, it's that polygamous community, former Warren Jeffs compound there, where a lot of those families have opted out of immunizations.
Exactly.
And you say this is clear proof.
That's exactly right. When you don't get the children vaccinated appropriately, you're going to have clusters of outbreaks like this. And the 300% increase in Arizona and Colorado City, for instance, is proof of that. I usually tell my patients who ask, I tell them about the situation where I have a vaccine called a mouthless influenza.
Okay.
That we didn't get a vaccine really going until the early 90s, but before that, I was seeing 1 to 2 cases of that kind of disease in my practice a month.
Okay.
After the vaccine was instituted in the early 90s, I haven't had 1 case of a mouthless influenza type B meningitis in my practice since like 1993. So that shows you the efficacy of the shots.
And we've had folks from the State Department of Health come in as well and say this is a dangerous problem because the more families that you have that are making that decision for themselves and their child, they're making everyone else they go to school with susceptible.
Everyone's at risk when you're around children who are not immunized. Okay,
something very important to think of. So get the shots. And everyone's got to do it because, like we said, it's back to school time right now.
And this is the most important time to make sure your children are immunized properly because back to school, we call it the incubator effect.
It is.
And when children go back to school, they're going to get exposed to all kinds of disease processes. Your children have to be protected.
And then they bring it home into the house and spread it around the house, and it just spreads like wildfire. Dr. Wooten, thank you for sharing your perspective with us. You've been in the business for a long enough time, and you can find him. He's got offices in Chandler and in Phoenix. Let's go ahead and